Hi, I'm Dr. Richard Bonato. I am a sleep researcher and I'm also a registered sleep technologist. I wanted to talk a bit about sleep apnea. So one of the major problems with sleep apnea is that it causes you to die earlier. People with sleep apnea have a much higher risk for heart attack, stroke, hypertension, diabetes, gastroesophageal reflux, gout, and a number of other disorders. So basically, people that have sleep apnea don't breathe properly at night. And the most important thing your body does is breathe every day, all day long. So we can go weeks without food, days without water, but only a few minutes without air. So if you don't breathe properly, you wake up in the morning, often have morning headaches, you feel like crap, morning irritability. And if we can take care of that sleep apnea and help you breathe better, you can actually feel 10 or 20 years younger. It's amazing how much energy you actually get back. Dentists are now getting more and more involved in the screening of sleep apnea because when they look inside a mouth, they'll often see a lot of symptoms. Scalloped tongue, narrow airway, abfractions and wear and tear in the teeth. And from there, once you see those signs, it's often just a matter of asking, does the patient snore? So you need to communicate with the patients. And when you ask the patient, do you snore, and they say yes, then you can talk to them about the other symptoms, morning irritability, morning headaches in the back of the head right here, and ask them if they're, how much energy they have, if they're feeling tired during the day. And there's some simple questionnaires that can be used, like the Epworth Sleepiness Scale. And when that's used by a dentist, I'd recommend that you also give the Epworth Sleepiness Scale to the bed partner, because the bed partner will often score the patient higher than the patient will score themselves. And then from there, if that comes back positive and all of this information suggests the presence of sleep disordered breathing and sleep apnea, I would recommend a Metabite test or a home sleep test to actually confirm the presence or absence of sleep apnea based on quantifiable objective information. And from there, once that information comes back, if the test comes back positive, you can then refer that information out to a physician, get a physician to make a diagnosis, and get a letter of medical necessity or a prescription from a physician to make an oral appliance. But if the test comes back negative, I would then refer the patient to a sleep laboratory, just for a double check and follow up, because there might be something else going on during the night that requires closer attention and examination from an accredited sleep laboratory.